Dr. Fred Coville of Cornerstone Plastic Surgery joins us now with his feature, Ask Dr. Fred. So let's jump right in. Heather from Pomona asks, I like the results from Botox and fillers, but I always bruise. Why is this? Is there anything I can do?
Well, good morning, Heather. You are not alone. People can bruise after injectables and fillers, and that's why I always provide my patients with a cold pack to use before and after treatment. I find that applying that to your face for 5 or 10 minutes before your treatment really works. You also need to avoid taking any blood thinners like Advil, aspirin, or ibuprofen, to name a few, prior to any treatment. Many people find that taking arnica works before getting a treatment really makes a difference. You can get arnica at any good health food store. Technique is also very important. A good injector will take their time and inject very slowly. If there's any bleeding, a little gentle pressure for a few minutes will do the trick. These tips should help out. But Heather, if you are prone to bruising or bleeding in all aspects of your life, that's something different, and you need to check that out with your doctor.
All right, and Douglas from Smithville asks, I'm prone to keloids and have been told over and over again that I can never have any cosmetic work done because of scarring. Is this true?
Well, good morning, Douglas. This is a special area of interest for me, and I've spent many years all over the world working with patients who are prone to keloids. Let me tell you right off the bat, Douglas, it is simply not true that you cannot have any cosmetic procedures without keloiding. Keloids are scars that grow beyond the borders of the original wound. They are more common in people of color, but I've seen them in all races. They can occur even with simple procedures such as piercings. Keloid prevention is possible in most circumstances, but there are some special techniques that must be used both before any surgery as well as after. These disfiguring scars can be prevented and treated very successfully in the right hands. I spent a great deal of my career perfecting ways of treating skin of color and skin that is prone to poor scarring. Douglas, of course, there are never any guarantees, but with the right preparation and the right techniques, your chances of developing a keloid will be tremendously reduced. Always ask your surgeon if they are comfortable working with people who are prone to keloid. If they're not, please find yourself an expert.
All right, thanks, Dr. Fred. And if you have a question regarding plastic surgery or aesthetic medicine for Dr. Fred, go to our website, NBC40.net, and click on Ask Dr. Fred. Dr. Fred will answer your questions right here on Today in South Jersey every Wednesday morning.